Hello friends, today I will share a case of polycystic ovary syndrome, PCOS, that I treated earlier. The patient was a woman under 30 years old who came to see me because of long-standing menstrual irregularities. Specifically, her periods were irregular, with a scant amount of dark blood and clots. She sometimes experienced bleeding between periods. She was lethargic and lacked energy, was slightly overweight, and had breast tenderness. Her eating and sleeping habits were normal, as were her bowel and bladder functions. Her tongue was pale red with a thin, slightly greasy white coating, and her pulse was deep and fine. This patient had been diagnosed with PCOS following a gynecological ultrasound examination. Menstrual irregularity was one of her symptoms. In Chinese medicine, we often talk about treatment based on syndrome differentiation. This concept of syndrome in Chinese medicine is different from symptoms and disease names in Western medicine. Let's analyze her condition based on our traditional approach. We examined the patient holistically, starting with an overall observation, or inspection diagnosis. The patient's lack of energy indicated a deficiency condition. Her overweight body suggested the presence of phlegm dampness, which can arise from a weak spleen. This was our initial impression. Menstrual issues are closely related to the circulation of blood in the body, which in turn is closely linked to the liver, heart, and spleen. Why? Firstly, the spleen generates blood, and it also controls blood circulation within the body. A weak spleen fails to control this, leading to bleeding outside the blood vessels, causing bleeding between periods. However, bleeding caused by spleen deficiency should be scant and pale, as the blood generated is insufficient. Our patient had scanty menstruation, which was consistent, but the dark color and clots indicated blood stasis. Where did this stasis come from? One reason was spleen deficiency leading to phlegm dampness, evident from her overweight body and greasy tongue coating. The phlegm dampness obstructs the blood vessels, causing blood stasis. Another reason was related to the liver, which stores blood and regulates its flow. The irregular timing of her periods indicated liver qi stagnation. Qi drives blood circulation, and stagnated liver qi can lead to blood stasis. This was evident from her breast tenderness, as the breasts are on the liver meridian pathway. The heart governs the blood vessels and the mind. Impaired blood circulation can lead to heart malnourishment, manifesting as lethargy. Additionally, the spleen governs the muscles and limbs, and spleen deficiency can lead to a lack of energy. Thus, the patient's fatigue and weakness were related to deficiency in both the heart and spleen. Her deep and fine pulse also indicated a deficiency of qi and blood. We observed the impact of the liver, heart, and spleen on menstruation, but there was also an underlying cause, kidney deficiency. Why so? This involved an interesting concept in Chinese medicine known as Tian-Gui. Tian-Gui's function is complex but closely related to reproduction and development. It controls menstruation in women and ejaculation in men and originates from the congenital essence in the kidneys. Therefore, many menstrual issues are related to kidney health. Moreover, there is an interconversion relationship between liver blood and kidney essence. Kidney deficiency can affect the generation of liver blood, impacting menstruation. Also, the spleen, postnatal foundation, and kidneys, prenatal foundation, nourish each other. Kidney deficiency can lead to spleen deficiency, causing phlegm dampness and other symptoms we discussed. Although the patient didn't exhibit typical kidney deficiency symptoms like backache, her condition manifested indirectly through her menstrual irregularities, affecting the liver, heart, and spleen. Why didn't she show typical symptoms of kidney deficiency like backache? Although she was under 30 and generally in a growing phase, her deficiency wasn't pronounced. Therefore, the overall diagnosis for this patient was primarily kidney deficiency, combined with liver qi stagnation, deficiency of both heart and spleen, and mutual obstruction of phlegm and stasis. While the patient presented with menstrual irregularities characteristic of PCOS, the underlying condition was quite complex. She was treated with acupuncture, initially focusing on kidney tonification and blood activation, using points like Taishi, Jiaoxin, Qihai, Guanyuan, Zhongji, Guilai, Xuehai, and Shinshu. Gradually, we incorporated treatments to soothe the liver, nourish the heart, strengthen the spleen, and resolve phlegm. Additionally, we advised adjustments in her diet and lifestyle. After about half a year of treatment, her condition improved. Her menstrual cycle became more regular, and she continued to make adjustments. Eventually, she became pregnant and gave birth to a girl, which was a great outcome. That's all for today's share. Goodbye.